We are just days away from spending another holiday with the Omicron variant of COVID-19. Here with some advice is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Good to see you, Doctor.
Great to see you, Dr. T. Yeah, sitting at the table with us will be the Omicron variant in one of the seats. So it's not new, though, but many of the mutations are, Dr. T. So do you expect Thanksgiving to trigger another big wave of infections?
So here's the setup, Eddie. BQ1 and 1.1 has really caused and forced BA5 to fade into the background. So that seems like it's a scary thing, a new variant with winter coming. But here's the good news, and there really is very good news for this Thanksgiving. BQ 1.1 has already gone through surges in many different countries throughout the world, like France, and it has not led to increased hospitalizations. It has not led to increased deaths. And even in some countries, it hasn't necessarily led to a surge in the number of cases. Now, remember, counting cases is tricky as we're doing so much rapid testing, but I really think that we're in better shape than we've been before.
Wow. Good.
Yeah,
we like
good
to hear you say that because we've been doing this interview with you for how many years
yeah,
now?
Yeah, right.
All right. So
About time, Maria.
Right. And we'll keep doing it until we get through this. We've been through so many surges. That's what we were just talking about. So many shots. Based on what you're seeing as an infectious disease specialist, is there anybody left who doesn't have some kind of immunity from COVID?
Maria, not many people at all, right? I mean, we have seroprevalence, that's antibody studies from this country, and it shows that by the end of February of this year, 60% of us were infected already. And think about it, it's 8 months later, we've had a number of variants that are even more contagious. So the likelihood is that probably over 90% of us have been infected, some of us asymptomatic, so we don't know it. And then when you think of all the people that have been vaccinated, there's probably very few people that either haven't been vaccinated or haven't been infected.
Dr. T, you've kind of hinted at this next one in our conversation today, but what about the COVID patients that you are seeing like right now? How does it compare to last year, and what can you tell us about numbers, especially in the ICU?
It is a world of difference, Ed. I mean, the bottom line is this: I'm not getting consulted on that many sick patients in the hospital. Right now, there's 2 patients in our intensive care unit. There's only 20 patients in the hospital with COVID. About 3/4 of them have come in for COVID. A few of them are asymptomatic, and we detected them on admission. But the patients in the unit, don't get me wrong, they're very sick, but even they are doing better. Now, the patient that I'm seeing is immunocompromised, elderly, got the primary series, was boosted, but hadn't been boosted in over a year. So I still want to reinforce boosting is important, if not for everyone. It's very important if you're compromised, if you have a lot of comorbidities, if you're elderly.
Doctor, it's been more than a year since we've seen a new variant. So do you think it's becoming more likely that Omicron could be the last?
Wow. I think we'd have to be pretty optimistic to think that Omicron and COVID-19 has really shown us the last of its magic tricks. I think there's more out there. I mean, remember, this is an RNA virus. You've heard me say this before. It mutates for a living. As my assistant said, even now in the United States, there's a rainbow of subvariants. So to think that this is the last one, I don't think so.
But you're feeling okay about Thanksgiving? Leave
Feeling
us with something positive. Okay.
Ready for this. Okay, let me just end it by this.
Okay.
11/18/2020, 2 years ago, there was over 9,000 deaths that day. 1 year ago, there was 6,800 deaths. This year, today, so far, 618 deaths. It's still too many. By the way, that's globally, not in the United States. That's globally. But think about we're doing so much better than we've done before. Each year we're doing better. I'm feeling very good about this Thanksgiving.
Dr. T, great to see you. And if we don't see you, happy Thanksgiving.
Yes, we wish you the same to you and yours. Be well, doctor. And to our viewers, if you have any COVID-related questions that you would like our experts to answer, email them to ask@wcvb.com.